Welcome, everybody. Today is for Dr. Sanet and myself, and we'll just call each other Bob and Paul today. It's Friday, June the 3rd, 2022. We're each in our respective homes, and we're just going to have a wonderful informal exchange today on the topic of sports vision. So welcome, Bob.
Thanks, Paul. It's a pleasure to be here with you and do another interview with you.
Yeah. The topic for today for us is sports vision. And I think what I'd like to start is there's so many misconceptions about what sports vision is and what sports vision isn't. You've had a wonderful career, been involved in the sports vision section of the AOA. I know that you've spoken at the International Sports Vision Association meeting. You've been involved in this for a long time. You've worked with the U.S. men's volleyball team. You've worked with many other individual players in many different sports. But I think I'd like you to just sort of start with, where does sports vision fit into the whole idea of what we do as optometrists?
Ooh, very broad question. That's going to take a little bit. So first, it's part of optometry for sure. And in one sense, on one level, it's just optometry for a slightly different group with slightly different, few more dynamic procedures done in a different way, but it's basically part of optometry. Different people have different levels of involvement. To some people, it means doing screenings on a team or treating eye injuries on a team. And they're actually on field and their only job is really eye injuries or replacing contact lenses during a game should a player lose it. Other people just sell sports eyewear and they call themselves sports vision optometrists. Other people are more involved in terms of assessment and training, which is where my greatest interest was. But I think it's important to remember that it's just all part of optometry. And it's a term used for communication in a sense more than anything else. Like when I say I'm working in the area of acquired brain injury, I'm working in the area of sports vision, but there are human beings with visual needs that I can improve through my care. So I don't really see them as all that different than a child with a learning problem, or somebody with strabismus, somebody with an ABI, or working with sports vision. Again, I think there are some differences, but I think it's really important to remember that it's part of optometry, and it's always been a concern to me with people who, I'm a sports vision. I don't do vision training. I do sports vision, or I do a brain injury, but I don't really do vision training. It's like, what? I just can't understand that type of division.
And I think that's where I was going with this, Bob, is that there have been these little cubby holes or cutouts that people have made for it. Both you and I just look at, we have a person that comes in, they have unmet needs,
Right.
and we find ways to help them meet what their needs are. And many people are involved in sport. And if that's what their specific needs are, we pull from our bag of tricks and we do what's necessary to help them be the best they can be.
Exactly.
Yeah.
Exactly. To me, sports vision is a marketing tool. The term is a marketing tool more than anything else, a communication marketing tool. In the same way, other things are used that way. But again, to reiterate, it's just part of optometry.
Yeah. Now, I know you're probably familiar. I've gone into several countries new. When the first time I went into Denmark, for example, they were like, we're going to start with sports vision as the way to bring VT into this. The idea is we'll get some big figure in sport who'll do VT. It'll change his or her life. He'll talk about it, and VT will be on the map. And they think they can start with sports vision with this high level athlete rather than having it emerge out of really good foundation in basic VT. I'd like you to speak to that a little bit.
Well said, Paul. It even goes even before VT. You have to have a theoretical basis for looking at the visual system and the visual process differently. If you don't have that theoretical basis, which is, I'm sure, part of what you're teaching in your courses in Israel, and I know elsewhere in the world as well, that you have to have a philosophy and understand certain concepts and theories and look at vision in a very different way than just do a refraction, prescribe for the measure for best visual acuity and look for some pathology and you're done. So it begins with philosophy. Then for sure, you have to understand the whys of visual training, not just the techniques, but what are you trying to achieve in each procedure? What are your goals for the patient in this procedure? And as you said before, the goals are just to enhance the person's ability to whatever their individual potential might be, which is usually greater than they think, or many times even what I thought their potential would be. But to start with sports vision is probably it's like starting with esotropia. I don't know much about vision training, but I think I'll start with strabismus. It's just not where
all you out there with convergence insufficiency, please hold back because I'd like a real challenge first.
Exactly. Give me somebody with I'm going to start with people with 3 surgeries, ESO with a big hyperdeviation and maybe a little cyclo in there as well, and maybe 2200. And I think that's a good place to start vision training because having success with that, I'll just have patients come in. On the other side, to be a little more serious, I found that an interesting discussion. My first sports vision patient wasn't really for sports vision. I had a high school athlete come in. He was an excellent high school basketball player. I found he was -1.5.
Okay.
I gave him contact lenses, or actually my partner fit the contact lenses, but I did the exam, gave him -1.5, and his gain went down to tubes for a while because obviously the minus changed his whole spatial perception.
Right.
So that was my first sports vision patient, which was a total failure. He actually took off the contact lenses and did a hell of a lot better without his contact lenses than he did with his contact lenses. Now, I might still fit him with some lenses, but I would do a lot differently than just slap on the lenses, get back on the court type of a program. But my first real, where I had an awareness, was a very famous baseball player. He's actually in the Hall of Fame now. His name is Ozzie Smith. He played for the San Diego Padres, and then he played for the St. Louis Cardinals, one of the greatest shortstops in the history of the game. I thought, and he, by the way, his batting average went up dramatically. It was more for batting than for fielding. He was a great fielder before he came in. And his batting went up dramatically. And I thought the whole team's going to come in. I mean, this is it. I'm going to be on the map. No, he kept it to himself. Right. Don't tell anybody I'm going for the vision training. So this idea that you get a famous athlete and he's now going to, go on national TV and that's going to put you on the map. I don't know anybody that's happened for, anybody. And I know lots of people have done sports vision, many on very famous golfers or very famous football players or basketball players or soccer players or whatever. None of them are on the map.
Or they're not on the map because that
they
opened their mouth.
Thank you. Right.
Exactly.
They could be on the map for other reasons.
Sure,
I mean, you've dealt with, you're certainly on the map, Paul, but not because of you worked with X race car driver or that athlete. Again, I think a good basis in understanding the visual process in a very different way, having a different philosophy, and then getting into some basic vision training techniques, and then just applying those techniques actually to sports is really what I did. I'm sorry, if I would have thought about it, I would have got some of my slides up here from you've seen those slides. But basically, I worked with pretty much all of the things I work with every patient with, only I modified it. So just to take a very basic example, I deal with the Brock string, where almost all my patients have a Brock string sometime in their therapy program. There might be some exceptions to that, but I'd say close to 100% have a Brock string sometime in their therapy program. But usually it's related to near point in general. I have more patients with near point symptoms, so a Brock string of 20 inches or 24 inches is plenty. For volleyball, by the time the ball is 20 inches from your face, it's too late to have a motor reaction to the volleyball. You have to make your decision way before that. So we had a 21 foot, 7-meter Brock string that was, and the reason it was that length, it was the longest transverse on my very big therapy room that we had in the office, and it was in up gaze.
Right. That's what I was going to bring up, is it has to be in that up gaze, because so many times they're going for this overhead. You may even pull a string almost straight down from the ceiling at times.
Yeah, I never thought about that, but exactly, but different angles, different ways, with movement, all kinds of stuff.
For me, serving at tennis, right? They throw it up. We'll have this absolutely straight up and get an idea at these different distances. What are we seeing? When you jump up. Yeah. So
it's just a Brock string, not just the Brock string. That's a phenomenal feedback tool that we use in therapy. But you don't need these fancy machines, although they're very nice and they're good for marketing, and athletes love them because they get a score and it's real fancy and it looks good. But I had tremendous success with the volleyball teams through, they won 2 golds and a bronze in the 3 Olympics I worked with the team for the 13 years I worked with them. And we did Brock string, we did rotators, we did balance boards, we did vectograms, we did the kistoscope. Vanilla
VT stuff, but you customized it to the types of visual demands that they would see in that. They weren't just seated in front of something static.
Exactly. To do vectograms while they're seated, or to do heart charts and down gaze while they're seated, is not really, if you're sitting when you're playing volleyball, you're probably not going to get that point. But again, a lot of up gaze, a lot of movement. They were jumping when they were doing things, lots of fields of gaze, et cetera, all the things you mentioned. We thought about a few dynamic techniques that were, I don't know, unique, that nobody else thought of them, but we didn't have them in our repertoire before that. And then we had the athlete come in and it was like, okay, how are we going to modify this technique for the specific needs of this athlete? But the equipment was the same that we used for every other patient.
Right. And before a person starts to work with an athlete with a interesting or a slightly different demand, it's good to have had experience with tens, hundreds, maybe even thousands of general patients that you've worked with these things on, to then be able to find the insightful way to use it. So having that solid foundation is really important.
Yeah, as a matter of fact, that's very well put, Paul. If I didn't have that repertoire with those hundreds or thousands of VT patients prior to beginning with the athlete, I wouldn't have had a clue on how to modify the procedures for the athlete. It came from experience working with the other, just like I modified it for a child with Down syndrome who came in, or a child with CP who came in. I modified procedures that way and to meet the needs of the patient, the visual needs of the patient. And I don't really see it as that different. Again, this is probably going to be a recurrent theme, but all that different than working with a child with CP and vision training. You have to modify the procedures based upon what the patient brings to the therapy.
Look, I think the message is important. You've said it a couple times here. I've said it many times in the course that this is not a totally specialized. It emerges out of the core of what we're doing. And I think I'd like to maybe shift for a moment and have you comment on the vast majority of the people who benefit from our therapies that apply them to sports aren't professional athletes. They're just people.
Oh, for sure.
Yeah. And I'd like you to comment on that, because that's always what sort of got me seeing these.
I think sports vision came out of not something that a group that invented, just the opposite. They were seeing patients for learning related vision problems, and the parent or the child would say, by the way, he's really hitting the baseball better. Mm-hmm. By the way, his basketball has improved tremendously, or whatever it is. He's driving more safely. And it's like, wow, baseball improved, this improved, that sports improved, and we did these things. Can we now make it more customized for sports rather than just it happened to get better, sort of attack it directly with that? The other thing I wanted to comment on, Paul, which is really critical, it's a story that was one of the turning points in my optometric career. So through a series of events, I got to work with the Olympic team, never having worked very much with VT before that. A little bit here, one person here, one person there, but nothing major. And then I get a call one day, how would you like to work with the United States, U.S. men's Olympic team a year before the Olympics in 1984 was the first one I worked with them. Mm-hmm. Probably before many of the people watching this were born. Yeah. But so if you want me to go into that story, I'll go into that story more deeply, but that's not the real story. Yeah. So now I'm working with the team. We evaluate the team. I'm working with the team. And one day the coach comes in unannounced. The coach had a PhD in exercise physiology and was also a former Olympic player, a national team player himself. And he said, what's going on? I want you to, explain some of this to me. So happened to be working on a saccadic board called the AccuVision in those days. And
for everybody, the AccuVision.
Thank you.
Yeah, the AccuVision was a large board with multiple different touch sensitive areas, and they would come on randomly. You could program it for different things, but similar to the Wayne saccadic fixator, a little similar to Benovi Touch, those kind of things. Now your Sanet Vision integrator does some of the same kinds of things.
Right. So it was this board again where just they want to rapidly hit these lights as they come on randomly. And I said, come over here. Let me show you, and I looked back through the file and I said, when Craig came in, he was only able to do, I'm going to make up these numbers because I don't remember, it's a long time ago, very long time ago, but he was only able to do 70 in a minute, and now he's up to 145 in a minute.
Yeah. And
he looked at me and said, of course, he's been practicing on it. And I said, that was like a click. What am I trying to do with this? Just get a higher score? Or am I trying to arrange conditions for learning? So I then began to have a different language when I instructed them. I set up the procedures differently. I did many things differently, but just doing one of these boards, and there's actually people who go out and buy a very expensive instrument. I won't knock the instrument, but there's a very expensive instrument now where you test, you train, and you retest all on the same instrument.
Right.
Of course it's going to get better. Is that going to transfer into sports, or is it just that exactly. The person who knows? The person now gets a gold medal in this instrument. It transfers into nothing.
If only they use those instruments in
Right,
competition.
in competition, they would probably get a gold medal.
Yeah.
But in terms of transferring into sports, so I went back after that and really thought differently on what do I want to achieve in the vision therapy procedure? What awarenesses? What are my goals? And my goals, although they like to get a big score always, my goals were really different. It really was a click for me. It was really a turning point, not only for the athletes I was working with, but also for all of my patients, really. It started me down a very different road in terms of not just doing the procedure, but what are my goals? What do I want this person to achieve? What awarenesses do I want them to gain? What learnings do I want to take place during the procedure, not just doing the procedure?
Exactly.
You know, you get an A+ on Brock string, you know, who cares? But if Brock strings teach you where to point your eyes in space, and you have that awareness, that could be very beneficial.
Right. Let's say, for example, a baseball player tends to be swinging early, and on the Brock string, they see it meeting closer. Our goal is not just to get the strings out, but for the person to actually feel relaxed at the plate, so that instead of thinking, oh, I'm always early, let me do something to try to be late, let me just naturally swing in the right place.
That's exactly. I had a professional golfer in the same way. She was short all the time.
Never up, never in.
So she just, okay, I'll hit it harder.
Right.
So she'd hit it past the hole. She'd make all these compensations.
Change where I'm aiming. In basketball, I always hit the front rim, so I'll aim for the back rim. It's like, no, I want to fix the problem, because here's what happens. There are little compensations. I know you know this, but this is more for listen to this, is their compensations will work when there's no pressure, when they're practicing, when they're either way ahead or way behind, but they come down to the last hole in golf or the last 30 seconds in the basketball game. We need this point or we've been eliminated in the volleyball match. And the underlying tendency that didn't get fixed is exactly what comes out.
Exactly.
And that's the mistake.
Well said. I can't even add anything to that. We need to be training something different than just compensatory skills.
Exactly.
Matter of fact, 100% of the people with visual problems have compensatory skills.
That's the way they're being successful in life.
Exactly. It's the way they get by with compensatory skills. You know, I read for a while, then I close my eyes. I skim and then I memorize. I make lists. I do all these compensatory things, or I listen to tapes, or I do this, or I do that, rather than fix the problem and be able to read for 4 hours or 5 hours without fatigue, without symptoms.
Exactly. Right. Can you come up with a quick workaround for me? And it's like, yeah, but that's not the thing. Like, for example, I had a batter on the Orioles many years ago, and he was going through a slump kind of thing, and I saw that it was meeting closer, right? And what did I do? The batting coach was actually with me in the office with this guy, and I said, well, let's widen your base, come down a little, bend in the knees, flex in the knees, and we saw in the string it moved right out. And he went 3 for 4 that day, 385 the next few games. But I told him straight out, I said, this is just a quick compensatory thing. This is not fixing the problem. This will not stay. The only way this is going to get fixed is through actual vision therapy. Didn't hear it, didn't pay attention. And long story short, within a year, he was basically in the minor leagues again, out of baseball.
Yeah, that's one of the challenges of working with top athletes. And it's not just for us. It's interesting. I spoke to some batting coaches when I was working with some professional baseball players. And I was saying, I can't get them to do this differently. And he said, either can I. The guy's in a slump. I tell him to hold the bat differently, or I told him to have a little different stance, move his foot left forward. And it's very difficult to change because they have in their minds, this is what got me to this level.
Yeah.
I don't want to change anything. And what they realize is they need to change and modify their performance as all kinds of other factors change, including their own bodies
Yes.
change, and their visual systems change over time. And they think what they had 5 years ago, they're going to do it the same way and make it to the majors. And obviously some do and are very successful, but there are tons of people who go up to the major leagues, can't cut it, and they're back in the minor leagues in 3-4 years or 5 years, they're out of baseball. When if the problem was truly corrected, I think a certain percentage of them would be able to have careers in professional baseball.
And you hit on something there too. You need to be open to modification and change as you age, as you. And there was a wonderful thing about Cal Ripken, and obviously Cal had the longest streak of being healthy and in every game. Of all of the different batting stances and styles he used, and they were in a funny way naming them, and standing tall down here, bat up, bat down, bat here. He had one they called the violin because he was pumping it on his shoulder. But just before, as he's ready to swing, it looks pretty much the same. But lots of different ways to go through the preparation to stay fresh, to get a good view of what's going on, and simply act in the moment.
Phenomenal player, obviously.
Yeah.
By the way, Paul, there's a little, do you hear a little beeping?
I do not.
Okay, then it must be on my end. No problem. Yeah. Okay.
We won't have to send anybody to, no.
Okay. Okay.
No beeping. I'll see when I listen to the recording. It's all good. So you work with some amazing athletes, particularly volleyball. I know you worked with other members of the San Diego Padres. I'm trying to remember the slugger who really the first baseman, I think he was.
He was actually a right fielder.
Okay, yeah. And there was a wonderful news story.
He was on ESPN. Actually, Greg Vaughn.
Greg Vaughn. Yes.
Yeah, he was actually going to be dropped from the Padres. They were looking to trade him. And get rid of his contract, which was about, I don't know, I'm going to say at that time, $1 million a year. I don't remember exactly what his contract was. But he went through vision training. He was, by the way, a wonderful patient, very open to modification, very open to learning, big guy. If you looked at him, you figured that this guy's not going to be.
But he was also somebody who it was fine to tell his story.
Yes.
He went public with what he did.
He did. He went through the vision training, made some major gains, was one of the only, I don't know how many people are, 80 people in the history of baseball that hit more than 50 home runs a year. I mean, that's a very small number, actually. And he hit more than 50 home runs. He won Comeback Player of the Year. He gave us one of his game shirts and wrote on it, thanks to vision therapy, blah, blah, blah. He was a super nice guy. But interestingly, we asked him, which procedure do you think was the most significant procedure for you to help? He says, chalkboard circles or by manual.
Or we call motor equivalents.
Motor equivalents. Or I guess in the slang, chalkboard circles. Mm-hmm. He felt that procedure, and we modified it a little bit, but basically that procedure was the most meaningful procedure to him. And it gets back to a quote by Robert Kraskin, your mentor, one of your greatest mentors, who said, you never know which procedure is going to be the procedure that's going to be the breakthrough for a specific patient.
Yeah. And just like Bruce Wolf said in the exam, you never know which one little piece is going to give you the insight into who the person is that's in front of you. So beautiful simpatico types of things from Kraskin, from Bruce Wolf, from the people whose shoulders we both stand on.
No question. Yeah. So there you go. I mean, it wasn't the saccadic fixator. It wasn't some $18,000 or $25,000 instrument with lights and buzzers.
2 pieces
and
of
this and
chalk
that.
and
It was 2 pieces of chalk. Exactly. It was chalk. It wasn't even a whiteboard. It was a chalkboard.
Yeah.
But there's a really nice photo I have also of him working on the chalkboard with a little 6-year-old standing next to him, watching him do it. Another therapy patient. We just integrated the athletes into our therapy program.
Yeah. No, I think that's great.
So for the people just getting started, again, coming full circle to the question you asked me, I don't know, about 10 minutes ago, if you have a good philosophy and understanding of the visual process in a very deep way, like, of course, you have a course, behavioral optometry. I don't know what your name is for your course, but the
Doesn't
number one
matter.
course
Yeah,
of your
yeah.
course.
But the art and science of behavioral vision care.
Right.
Yeah.
So if you have a good understanding of that philosophy from that type of a course, then you can begin vision training. Then you can go into sports vision. And I think that's the progression that you need to do, but go straight into to buy a big instrument and now think you're doing sports vision is I don't know, like me buying surgical equipment and then going in and doing surgery. You need a little bit before you do that.
Yeah, Kraskin used to say you could visit people's offices and you can't tell the quality of therapy by the equipment that they have in the office.
Exactly.
And he also said, in his VT in Action, that publication,
wonderful publication.
He had the principles of VT, and that VT must emerge from a model of vision, the visual process. And that's exactly what you just said. And obviously, we've had a shared background in terms of who's influenced us and that type of thing.
Sure.
Yeah,
we're very fortunate. I'm so grateful for I'm an old guy now, but I'm grateful for the time I lived because I learned from people like Kraskin and Wax and Suchoff and Birnbaum and Flax, and the list goes on and on and on and on and on. The people we both learned from during a golden age of vision training.
I have a feeling, Bob, that people at every age, right, or when the current people listening to this get to our current age, right, they're going to say the same thing of that they were fortunate to be. And I think that's just sort of the whole circle of life kind of thing. I know both you and I are dedicated to stopping for a moment, taking time to share so that others can grab onto some of our experiences and maybe avoid making some of the mistakes that we made.
That would be a good seminar. I think maybe we'll do a joint seminar. The title will be "Mistakes We've Made."
Why not? We do a whole thing on strabismus, on the myths of strabismus therapy, right? So
I think that'd be a great seminar.
Yeah,
Mistakes we've made. I don't know if a 2-day seminar would be enough. I think we might have to do a 6 or 7 day seminar.
Yeah. So everybody, we've made a lot of mistakes between us, but I think that's also part of, we've heard it from Tony Robbins and others, so many things about it's the successful people are the ones who got up after the prior failure and just tried again and didn't let that failure get in the way.
Oh, sure. There's people who, again, they have a difficult case for some reason. It's not going the way they wanted to, and they give up not only on that patient, they give up on VT because the first 1 or 2 patients are not successful.
Yeah.
And there are other people who, okay, what did I learn from this? Can I do it better next time? And continue. And I've certainly, fortunately, and I'm sure that this is true for you, I've had way more success than failure, or making much fewer mistakes than I made 30 years ago or 40 years ago when I just started. But those learning experiences were crucial to getting to where I am now.
And I think for me personally, one of the most exciting parts is is the Sherlock Holmes part on the front end, is the problem solving. And I've now been fortunate enough, and I know you have. We've never talked about this. We have people who we've taught, who've learned from us. They've learned from many other people, but they might say we are their prime mentors.
Sure.
But they've come to us and said, I need help with X or Y or this kind of thing. And I know, I'll give an example. Aileen Hansen in Oslo, Norway, came to me many years ago and basically, oh, I have an in with the Norwegian biathlon team. And I was like, okay, what's no, you have to look some of these things up.
Sure. I didn't know anything about volleyball when I started. I mean, I knew there was volleyball, but I didn't know about the intricacies of the game, certainly.
But I just said, I will come, I will help you on the front end, and then I will lay out for you the way I would approach a treatment plan. And she executed it. And I love that kind of thing where we're, again, doing a Sherlock Holmes, figuring out what the issues are and helping others take this on to move to become, in their own right, leaders in the next generation.
Absolutely, Paul. You also said something I don't want to skim over because it's important for the people listening to this. I have, as you intimated as well, we both have a lot of people coming to us for various types of advice. And then you spend a lot of time with them and they go back and do the things the way they've always done it. They don't listen well. But there are others who take it in and learn. And I learned very early. I got some very good advice now 50 years ago, probably. You want to be successful. Find somebody who's successful at that, whatever it is. And in the beginning, copy them. Yeah. Don't modify it. Whatever they lay out, do it as they say, exactly how they say. And then you want to modify it later. You learn, you grow, you want to modify this or that. And that's what in sports vision, I have one of the optometrists that were in my course is now working with one of the major soccer teams in Spain. Wow. As their optometrist, but he listened to exactly what I said, or Pilar Vergara, who you know as well. Yes. She has a very successful practice in Spain, maybe the largest practice in Spain, and not largest practice, largest VT type practice. Right. I imagine there's bigger opticals in Spain for sure. But people say, how were you successful? Said, I went to Bob's office, I copied everything he did, and I took it to Spain. Now she probably has modified, I don't know, 25%, 30%, 40%.
So Bob, the
in the beginning,
the analogy I use, and I'm sure you're going to be simpatico with it, is in the beginning, we started as cooks, following recipes. Follow the recipe. Don't screw around with it. Don't think you can change. But over time, hopefully, some never do, but we want our people to evolve to become chefs. Right. And when they're a chef, they understand why this is here, how this fits together, why this comes in this order, why these things can be done at the same time and they're complementary, and how they set the stage for the upward spiral of development of a new ability.
Yeah, I think that's well said. And again, for me, because I'm so close to her, Pilar, exactly. She started as a cook. She said the same things in the conferences that I said, and exactly the way I said it. I mean, she was like a little clone in the beginning. She was a chef. She followed the cookbook. Right. You know, it said a quarter teaspoon of this. She didn't modify a quarter teaspoon. You know, it's an exact level quarter teaspoon, not a grain more, not a grain less. And now she's doing her own thing, you know, things I never thought about. You know, she's become a phenomenal chef in her own right. And that's great. But as by the way, you and I think also would say the same things about ourselves. I started out as a cook or as a recipe follower, if you will.
And we followed because we had the Sunni background. We
Right.
followed some very similar recipes in the
Exactly in the beginning, and then you
I went
evolved
down the Graskin and
into
up down it. Yeah.
wherever you went, and developed in the way you developed, and I developed in the way I developed, which is not that different actually. I'm
No.
moving them in different directions, but they're probably like more like, if I can get the camera right here, go.
Don't worry about it.
They're,
Yeah.
they're more like this in a sense, not like we developed like this.
They're parallel and
They're very parallel
intertwined.
and intertwined, and we use a lot of the same things. We might use different language sometimes. We might choose a different technique because you like one technique more than another technique.
Exactly.
But the basic philosophy behind everything, I think, is probably pretty close to 100% the same, really. If you peel away all the superfluous stuff, I think the basic philosophy is very, very close.
Bob, I want to thank you for spending time with me talking about sports vision and sharing information with both this group and I think many, many people to come. Just any closing remarks in terms of lessons learned or things you'd like to,
boy, there's so
I know
we need another 4 hours for lessons learned as well. That could be another course. But I would say don't oversell. Make sure you're part of the team. I hear people that, again, if you just do vision training, I'll make you, win the Gold Cup, or I'll, you'll win the World Series, or you'll be, a batting champion. There are so many factors that go into that, including very simple things like injuries, but other things as well, whether they cooperate, don't cooperate, all kinds of factors go into that. So just think about yourself as part of the team, just like the strength coach or the batting coach or the manager of the team or this, that. You have a very special place in the total picture. Don't oversell what you do. Sell it as part of the overall team that's working to enhance this team's ability to win. But obviously it starts with good players. Also, you don't have good players. Don't even, me and Paul, if you start with me and Paul as your championship team, I don't care how much vision training you do, you're not winning a basketball championship for sure.
No.
So, so that's, I guess, my ending advice. And just one more thing. Again, I know Paul, I can speak for Paul in this and myself. We're available for help in any way we can to support all of you in your journey right, to providing optimal vision care to humanity.
And I'll close. I'll let everybody know here too. It's been a real pleasure to work with you, Bob, on the Sanet seminars.
Thank you.
The current one is in progress. I'm sure there's planning for one next year. I would encourage anyone who listens to this that's a wonderful way, either in person or online through the hybrid technology, to be part of something truly amazing that is complementary to other types of education that you do. So I'll make sure that there's information and contact for both of us, but also information on the Sanet seminars coming up.
Thanks so much, Paul. Be well, be safe, be well. And to all of my mishpacha in Israel, shalom.